My name's Mikayla. I'm from and born in Port Augusta, but I identify as an Aboriginal woman as well as Arabana, Narungga and Ngarrindjeri as well, all from my family's grandparents' side. I am an occupational therapist and have been working in Port Augusta at the Flinders and Upper North Local Health Network as an OT for the past 3 years. My family have always worked at the hospital. My mum, I think, went back to work after having me. I think I was 6 weeks old, and she always worked for the Aboriginal Health Unit. Her auntie was working in that space as well in quite a big role. And my grandfather, he was also working at the hospital as well and did a lot of the cultural awareness training and stuff like that as well. So working in health has always been a big thing because my family has always been kind of in that setting, especially with the government as well. SA Health put out a rural Aboriginal strategic health plan to try and increase the Aboriginal workforce, working with all of the regional LHNs to see what sort of funding and resources they've got and what their ideas of how they can improve the number of Aboriginal employees, but also how we can retain the employees that we've got, making sure that they feel culturally safe and supported. We try and align with them and see how we can, help them to benefit the Aboriginal workforce as a whole in SA Health. I am lucky enough that I get to meet a lot of people in my role from different regions and get to spend time with them and hear how they're doing things differently in their communities. We do, monthly catch-ups all the time, people that are in similar roles in different regions, and we hear about, all the stuff that they're doing and how we might then be able to implement that in our own places. But that catch-up also lets us network with them so that if we need more support, then we can catch up with them one-on-one outside of those monthly meetings that we have with them. I think the good thing about SA Health is that there is the opportunity to progress. So what you start in is probably not where you might end up. I think for myself, starting off as an OT, that's not what I'm doing at the moment. I've been able to progress in my career and step into something new. There's always the opportunity to learn. So if you go into an entry-level job, but then you've decided you really want to go down a different track, then they have the ability to be able to support you, that you can do further study while you're still employed, so that you can then progress in your career as well. Aboriginal workforce is huge. My auntie, she's actually the Director of Aboriginal Workforce for the Public Sector Office, which is really cool because that's almost as high up as what you can go for Aboriginal workforce. So being able to have someone who can mentor me in that area as well and see what they're doing at that larger scale of things is really cool as well. So it just shows that being in SA Health and government, there's just so many opportunities within the space that you're working in.